at our place, we have psychiatrists, psychologists, physician's assistants. So physician's assistants go through college, then they go through a specific PA program that's usually 2.5 to 3.5 years long. It's associated with a master's, but they do a lot of their training similar to what physicians do, in that they rotate with cardiologists, psychiatrists. So they have rotations throughout they have a year of books, and then they do rotations. And then they come out as generalists, and then there's some fellowship programs like for psychiatry and those things. And then they have to, we all have to recertify, but PAs have to recertify in every single thing: cardiology, family practice, psych, every so many years. And then nurse practitioners you have your RN, your BSN degree, and then you go through a specialty program, whether it be psychiatry, family practice, cardiology, and you specialize in a certain area. And you come out and you're prescribing meds. So the PAs, the NPs, and the psychiatrists are the meds prescribers in Nebraska. So personalized medicine, we're all about how do we take care of whoever it is, the employee in front of us or the patient. So there's some new things coming on board that I just like to tell people about a little bit. So there's people think about DNA testing, they think about looking at their own ancestry and those things, but now there's DNA testing looking at specific genes that metabolize the different psychiatric medications. So there's 4 or 5 companies out there, and there's more growing each time. And we can decide, we can take a cheek swab of somebody, we get it back in about 2 weeks, and we can look at that, and it doesn't tell you what medicine to prescribe, but it can say if somebody needs an antidepressant, which ones are they more likely to do better on based on their DNA. Are they good metabolizers of that medicine? Are they poor metabolizers, so they chew it up slowly, so a low dose will have a too high a blood level, and probably they'll have side effects versus therapeutic effects of that? Or are they rapid metabolizers, where it chews it up so fast that they're likely not to benefit because their body chews it up so fast they can't get enough to their brain? It tells us if they have certain forms of an enzyme that can convert folate in the periphery to brain folate that acts sort of like fertilizer for some of the antidepressants, or women who are pregnant who get prenatal vitamins, it always has folate. If they're not able to use that folate, but they need a specific form that is better to get to their brain. So there's stuff with stimulants on those things too. So there's a lot of different stuff. We have that type of information for pain meds. They've had it in cancer for a long time, but now we have it for like the lipid agents and things like that. So this is sort of the latest thing we do. We do transcranial magnetic stimulation, and this is sort of the helmet for this. It's magnetic MRI type of technology, if anybody's had an MRI. So there's 2 systems that are FDA approved in the United States for treatment-resistant depression, which accounts for about 3 million people in the US each year. So those are people who have failed 2 or more antidepressants. I mean, it's actually approved if you fail 1, but in most insurance it's either 2 to 4 medications you have to fail. And so in depression, your frontal lobe tends to be down-regulated, it's just sort of turned off. So you want to do something to make it fire faster. So this on the left, this is the brain's way, and it sends MRI pulses, so magnetic pulses 2 to 3 centimeters into your frontal lobe, and it does about 18 pulses per second, and it does that for 2 seconds, and then it takes a break, and it does that 55 times. And it actually can sort of reboot your neurons. And the thought is that it might even help you grow new neurons. Because if you get something high enough called brain-derived neurotrophic factor, if you turn that on, when you're depressed, it turns off. When you're not depressed, it turns on. And when that's on, you can actually increase the connection between your neurons and maybe grow them. So we actually are one of the busiest in the country with that. And I've seen around 350 folks. And in clinical use, it has about a 75 to 80% success rate. In research trials where they take you off all your medicine, it has about a 40% success rate. So, and there's no side effects in the periphery. It's just the main side effect is feels like a woodpecker on your head, and it has a little scalp discomfort at first, but your scalp accommodates pretty quickly. So, and there's even an air conditioner in the unit. And for you women, I know you would never worry about this. Guys never worry about this, but there's a little cap that goes on your head, and this goes over your head, and then you get the pulses, and then you take it off. And we have never had one person complain about their hair. So it's amazing to me. I think it's because people don't have the beehives like my mom used to in the 70s. That's never been an issue. So that's because we have a hairdresser on site. No, I don't. That's not true. So telemedicine, this is the way, this is just where medicine is going. This is what's going to, and over the next 5 years, this is going to be a huge part of all of medicine. If you don't have to be in the hospital, and the goal is to keep people out of the hospital. How do you keep them out of the hospital? You treat them as soon as possible, and you keep them out of your ER. You treat them before they have to go to the ER. Colds, people have early onset depression. The fill rate on an antidepressant, for example, a patient fills it once. What's the likelihood that they go get the second fill? It is 50%. It's horrible. So, and if you've had an episode of depression, you have a 50% chance of having a second. If you've had 3 episodes, it's over 90%. So you're on meds for life if you've had 3 episodes. So how can you make it so help people be more adherent? Because we all know if we're on an antibiotic for 10 or 14 days, how many people take that 100% of the time? Not very many. So I can't even remember to take my vitamin D every week. So, so reaching people where they are and when they can be reached is going to be a huge factor. And telemedicine allows that to happen. I mean, you can bring this stuff to smartphones, and somebody could pull over, and as long as they don't have they have privacy, the networks are secure, so nobody can get in on them. And it's as long as you understand the eye contact and everything, it just works like a charm. So we did over 5,000 visits on telehealth in Nebraska last year. So it's a very popular option, and kids, the younger generation, just absolutely loves it. And actually, the overall rate of when we take surveys, it's a 99% acceptance rate. Yeah, the biggest hurdle is usually the provider. It's not the patient, it's the provider. So, final remark, mental health does not discriminate. We might discriminate, but mental health doesn't discriminate. It hits across all socioeconomic realms. It doesn't matter what you do. I think everybody experiences various issues throughout the time.